Hello and welcome to the series of online training modules on parents with disabilities in child welfare. My name is Mingyang Zheng. I'm a doctoral student at the School of Social Work, University of Minnesota. This training is a collaborative effort between faculty at the University of Minnesota School of Social Work and the Center for Advanced Studies in Child Welfare at the School of Social Work at the University of Minnesota. This training module is part of an online theories training effort that covers a wide range of topics areas in child welfare. This training module, Parents with Disabilities in Child Welfare, has three parts. Each part is about 20 minutes. In part 1, we will talk about historical context and prevalence for parents with disabilities in child welfare. In part 2, we will talk about parents with disabilities and related policies. In part 3, we will discuss social supports for parents with disabilities. So now, let's get into the topic of historical context and prevalence for parents with disabilities in child welfare. There are three learning objectives for this online module. People who complete this training will be able to understand the historical context of parents with disabilities, be familiar with the prevalence of parents with disabilities in child welfare, be familiar with the current research regarding parents with disabilities and maltreatment in child welfare. So now, let's talk about the historical context. During most of the 20th century, eugenics was a popular science in the United States and much of the world. As a result, people with disabilities were routinely sterilized involuntarily. Indiana is the first state to pass the sterilization law in 1907, which authorized medical superintendents to sterilize people who were criminals or physically or mentally disabled. California and Washington also passed the sterilization law in 1909. From 1909 to 1937, other 30 states passed eugenic sterilization laws. One of the most famous cases regarding the involuntary sterilization of people with disabilities is Buck vs. Bell. In 1927, the U.S. Supreme Court's decision in Buck v. Bell legitimized the forced sterilization of people with intellectual disability at a Virginia home. The U.S. Supreme Court voted 8-1 to uphold the forced sterilization of Buck and her infant daughter Vivian. Due to the Supreme Court's decision, over 62,000 people in the United States were sterilized, and most of them were women. Moreover, Buck's sister, Doris, also was sterilized, but she didn't know until later in life. She had been told that the operation was to remove her appendix. Ironically, later research showed that Buck had normal intelligence. Her daughter, who died at the age of 8, also showed no sign of intellectual disability and was making good grades in school. Besides sterilizing people with disabilities, it was also a common practice to remove baby at birth if their mother were persons with disabilities. For more information about eugenics, please read a brief description of eugenics at the University of Virginia's Claude Moore Health Sciences Library. So, now we have briefly reviewed the historical context of parents with disabilities. We learned that they were unfairly treated due to their disabilities. Then, what about today? While state eugenic laws are no longer enforced today, society hasn't put much emphasis on understanding and supporting parents with disabilities. Here are some current challenges that we have encountered today. Research regarding parental disabilities are limited. Many studies have small samples, so we are not able to generalize the findings to the whole country. Also, most state child welfare organizations do not collect parental disability data well. There is no centralized record keeping by states on parents with disabilities. States are not required to record whether a parent has disability or not. Lastly, disability defined differently in different programs. For example, the vast majority of these statutes related to parental disability use outdated terminology, have imprecise definitions of disability, and emphasize conditions rather than behaviors. Here are some things that we do know. According to the Survey of Income and Program Participation Data, we know that lots of people with disabilities have children. About 11% of parents, or 6.9 million parents, have a disability, and about 30% of adults with disabilities have a child living at home. In terms of types of disabilities, roughly 1 million parents had mental illness, and roughly 250,000 parents had intellectual or developmental disabilities. It is worth noting that these figures are probably underestimated. We also know that parents with disabilities can involve in child welfare and have their children removed through termination of parental right. Here is a study conducted by Dassler and Lightfoot. They used a large administrative dataset, the Adoption and Foster Care Analysis and Reporting System, also called AFSCARS, to explore how the parental disability removal reason was used in public child welfare agencies in the United States. They found that among all TPR cases, 19% of TPR cases listed parental disability as one of the reasons for removing a child from his or her parents. About 5% of these cases, parental disability is a sole removal reason. They also calculated the frequency statistics of each state for both parental disability as a sole removal reason and parental disability as at least one of the removal reasons. They found that the rates of using parental disability as at least one of the removal reasons vary among states. In this table, we can see that some states have the rate under 10%, such as Alaska, Indiana, and New York. Some states have the rate below average, and the state of Minnesota is one of these states. Some states are above average, such as Wisconsin, Arizona. We also can see that some states use parental disability as at least one of the removal reasons very often. For example, the state of Ohio, about 54% of TPR cases listed parental disability as at least one of the removal reasons. Also, there are variations regarding states using parental disability as a sole removal reason. Majority of these states are below the average. However, we can see that there are several states are way above average. In the state of Ohio, we can see that about 20% of the TPR cases listed parental disability as a sole removal reason. So, to quickly summarize what we learned from those two tables, we can conclude that the rates of using parental disability as a removal reason vary radically by states. For example, we can see that Ohio and Wisconsin are way above average, and Minnesota and South Dakota are below average, and Illinois is way below average. It is also important to know that parents' disability status may have impacts on children's length of stay in foster care. In this graph, we can see that when parental disability is the only removal reason, children usually stay a longer time on average in foster care compared to those removal cases that parental disability is one of the removal reasons. And when parental disability is not a removal reason, children usually stay a shorter time on average in foster care compared to those removal cases that parental disability is one of the removal reason or parental disability is the sole removal reason. We can also look at the state of Minnesota. In terms of days in placement since last removal, when parental disability is one of the removal reason, children on average stay 626 days in foster care. When parental disability is not a removal reason, children usually stay 404 days in foster care. This is about a 220-day difference. When we compare parental disability is a sole removal reason versus parental disability is not a sole removal reason, we found that when parental disability is the sole removal reason, children stay 580 days in foster care. And when parental disability is not a sole removal reason, children stay 156 days less, which is 424 days. Similarly, when we look at the length in current foster care setting and total days in foster care, we all found that when parental disability is one of the removal reason or is the sole removal reason, children usually spend longer time in foster care, and this is alarming. So here comes the question. Do parents with disabilities abuse or neglect their children at higher rates compared to other parents? While reviewing the studies related to this area, we found that evidence is mixed. A study conducted by Azar, Stevenson, and Johnson concluded that intellectual disability alone do not lead to higher risks of child maltreatment. In their study, they recruited 73 low socioeconomic status mothers from Child Protection Service contact agencies and programs that provide services to disadvantaged mother populations. They compared 43 mothers who had CPS records for neglect and 30 mothers who did not have a history of child maltreatment. Their findings showed that parents with intellectual disabilities appeared to be overrepresented in the CPS system and were more likely to be labeled as neglectful. However, intellectual disability alone do not lead to higher risks of child maltreatment. McGowan, Scully, and Pritchard also conducted a study investigating the relationship between parental disability and child maltreatment. They conducted a secondary data analysis and investigated 101 parents with intellectual disabilities and 172 of their children. They found that parents with intellectual disabilities with physical or sensory deficits are more likely to abuse or neglect their children compared to parents with intellectual disabilities with poor mental health. Lightfoot and Slater conducted a secondary data analysis study using the Collaborative Psychiatric Epidemiology Survey data. They investigated child maltreatment risk factors of parents with disabilities. The findings show that parents with disabilities self-report a higher rate of a range of parental-related risk factors that are commonly associated with child maltreatment than parents without disabilities. However, they argue that because the pathway of maltreatment is unclear, we cannot simply interpret the finding as parents with disabilities are more likely to abuse their children. Rather, the findings from this study simply suggest that because a parent has a disability, the parent is more likely to have a number of risk factors related to a child maltreatment, such as poverty and unemployment. So then, what do we know about the child outcomes? Again, because parents with disabilities are a diverse group, the findings are mixed. For example, for parents with intellectual disabilities, about 40% of their children found to have developmental delay, though not all of them. 60% do not have developmental delay. However, while we assume that it might be because of lack of stimulation, when medical conditions and other conditions are taken into account, these differences fall away. Also, some show equal child outcomes. For example, a study conducted in Australia showed that children of a parent with multiple sclerosis did not differ any of the outcomes except for peer relationship problems. For example, adolescents of a parent with multiple sclerosis reported lower peer relationship problems than other adolescents. Overall, results did not support prior research findings suggesting adverse impacts of parental multiple sclerosis on use. Thus, more use of population-based data is helping to refine knowledge about outcomes, but for now we certainly can't assume worse trial outcomes. So now let's quickly summarize what we have talked about in this part 1. Parents with disabilities had been discriminated against historically, and today parents with disabilities are overrepresented in child welfare system. However, this does not mean that parents with disabilities are more likely to abuse their children. Evidence is mixed in terms of parents with disabilities and child maltreatment and parents with disabilities and child outcomes. So congratulations, now you have finished the part 1. If you're ready, now you can go to part 2.